Hi, my name's Simon Bott. I'm a consultant urologist and have been for over 15 years, and I specialise in kidney stones. Kidney stones are very common, affecting 1 in 10 people in their lifetime, typically in men in their second to fifth decade, but really they can occur in anybody at any age. Kidney stones can be due to a number of factors, and we investigate these possible factors with blood tests and urine tests to see why you might be at risk of kidney stones. So that means we can prevent kidney stone formation going forward and your risk of more stones. Kidney stones can be treated in a number of ways. Sometimes if they're small, we just simply leave them alone and perhaps monitor them by repeating a scan at some time interval after you've had the diagnosis. Sometimes we can use non-invasive techniques. This is lithotripsy, where we fire shock waves at the kidney stone while the patient is awake. We have a state-of-the-art lithotripsy machine which is available 5 days a week, where a patient can drive to the appointment, they lie on a special bed, and then we fire shock waves at the stone with the patient awake, breaking the stone up, and then the patient subsequently passes that stone out over the next few days. This can be done with the patient awake and the patient is able to drive and even drink normally before this procedure. Some patients aren't suitable for lithotripsy. If they're not, then we have the operative techniques. Firstly, we can perform what's called a ureteroscopy, where a small telescope is passed up the water pipe to the stone and the stone is lasered. Sometimes this is done with a straight telescope, but where the stone's around the corner in the kidney somewhere, we use what's called an access sheath, which enables me to get round to the stone, and as I break the stone up with a laser, the access sheath allows me to suck out all the bits that are made out of the body so there are no stones left in the kidney at the end of the procedure. This is normally done as a day case procedure. It does involve a general anaesthetic. If the stones are really big, then I need to do what's called a percutaneous nephrolithotomy. This means I need to make a small cut about 1 centimetre just below the rib cage and pass a telescope directly into the kidney. This enables me to break up large kidney stones and suck the pieces out, so that at the end of the procedure, the patient once again is left with no stone fragments left in their kidney. This does involve an overnight stay, but normally just one night. This is the most successful way of treating large stones. So kidney stones can be managed in a number of ways. All these techniques are available to me, and I'll happily see you to discuss how to manage your kidney stones.